All right, everybody. Time to get back together and continue with the program so we don't get too behind schedule. Good morning. My name is Katherine Tucker, and I'm a nutritional epidemiologist. I study diet and health, and I am moderating the next session, which is Emerging Insights. I will be the first speaker. I will start by just reviewing some of the issues with dietary needs in aging populations, and I will give a brief introduction of many of the vitamins and minerals of concern, and then you'll be getting more in-depth information about some of those specific nutrients after that talk. So I will jump right in and start talking about dietary needs in the aging population. We're all here because we know that diet is so important for keeping older people healthy. Diet and exercise are the major things that are going to help everyone live an active, healthy life and prevent chronic diseases. So it's hard to get the dietary requirements that older people need. It's particularly challenging because as you age, you actually need less energy. You slow down a little bit, your metabolism slows down. Your organs stop or slow down in terms of their efficiency, so they're less efficient in absorption and utilization of nutrients, which means at the same time that you're needing less total energy from food, you need in many cases more nutrients than younger people. To compound that, chronic conditions and medications often drain nutrients, especially B vitamins with some common medications, which means your requirements are even higher. And so high nutrient dense diet is the main goal. You need to be careful about those calories you put in and make sure that you're getting the nutrients that you need. And it's not easy. Here's just a few of the age-related changes that influence nutrient requirements. You've got decreased muscle mass, which means you need increased protein relative to your energy. Lower calcium absorption, which means you need more calcium and vitamin D. Lower immune function, which means you need more vitamin B6, vitamin E, and zinc. Lower B6 metabolic efficiency. B6 is one of the nutrients I'm very interested in because it tends to be low and it's important in so many metabolic reactions that help protect us. Less skin synthesis of vitamin D from the sun, so even more vitamin D is needed. Higher oxidative stress, so you need more antioxidants. Higher homocysteine, so you need more of those main B vitamins. Lower gastric pH, which is something that is unnoticed by a lot of people, and they develop vitamin B12 deficiency without even noticing it. Very important vitamin for older individuals. And lower liver uptake of retinol, which means that vitamin A in the preformed retinol is one of the exceptions. That's one of the nutrients you want to be careful not to have too much of. Better to get your vitamin A from your carotenoids. What did I just do? Okay. I just hit the wrong thing. There you go. So, at the same time that you have all these higher nutrient requirements, there's a lot of things going on that make it harder to choose the right foods and to eat enough of them. Many older people experience loss of appetite, changes in taste and smell, problems with eating with teeth, with dentures, oral health, mobility constraints. It becomes more difficult to cook the fresh food that is the healthiest, and low income in many cases limits the most healthy choices for people. And I did it again. Sorry. So we're going to just go through the nutrients as an overview, and one of the most important for older individuals is protein intake. As you're losing that muscle mass, you want to be able to maintain it by a combination of adequate, high-quality protein and physical activity. Right now, current recommendations remain the same for older adults as younger adults, but as you're going to hear in a subsequent session, many researchers think that protein requirements should be much higher for older people because of that difficulty in maintaining muscle mass. Some object to raising the RDA for the protein because there's also a balancing concern of kidney function. But I think overall we're tending to say that more protein is recommended than currently. Right now, even looking at a very low bar, we have older individuals that are not meeting the current recommendations, and this is not even the RDA, this is below the RDA. So low protein intake is a major problem, and we think it should be much higher. Protein intake, even above the recommendation, has been associated with better health, and this is from the Health, Aging, and Body Composition study, and you can see pretty much a clear dose response there. With the highest quintile of protein intake. With the lowest quintile, you have quite a lot of change over 3 years in your lean body mass. So that illustrates how important it is. In addition, our own work, we've looked at bone mineral density, and we don't tend to think about protein as much in terms of bone. In fact, it used to be that people thought that high protein led to bone loss because it leads to calcium loss in some cases of short-term experiments. But we found the opposite. We found, and others have also found, that higher protein doesn't hurt bone, it protects bone. So it is important to focus on protein. Another nutrient that's very important and is low in the entire population is omega-3 fatty acids. And we're learning a lot more about the balance of omega-6 and omega-3 in terms of pro-inflammatory states. And so we need to have more omega-3s in our diet to prevent that inflammation that is damaging our body. Low omega-3 is associated with heart disease, with cognitive decline, and even with asthma. It's hard to get enough omega-3 because it's very limited in terms of the food sources. It's mainly from fish, which is why we recommend 2 fish meals a day of fatty fish like salmon or mackerel or sardines. Those have been linked with reduced risk of heart disease. But you can also get some omega-3s from flax seeds, walnuts. So it's very limited, but you need to make an effort in order to include it in your diet. And here's the comparison. We see that, interestingly, even more men than women in the 50 to 70 and 71 plus range are well below the EAR for N3 fatty acids when we consider the DHA, EPA from fish and the ALA from flax, walnut, and vegetable oils. We've looked at N3 fatty acids in relation to a lot of outcomes, and this slide just shows that we saw a significant relationship between intake of N3 fatty acids and memory score and attention score. So cognitive function is significantly associated. The brain preferentially wants N3, and so it's very important for preventing cognitive decline. Hi, speaking of cognitive decline, Irv Rosenberg just came in. He's gonna, he's not having it. He's going to talk about it. And he's also a co-investigator on this study. So, this study is the NAME study, which I worked on with Irv. And what this is showing is that in addition to just looking at intake and cognitive function, we did brain MRIs, and we found that the N3 fatty acids were associated with lower hippocampal volume. So that's an actual physical association, not just diet, which confirms the association is important. Okay. And the next macronutrient that we're looking at is dietary fiber. And dietary fiber is something that's critical for, again, the entire population. We're learning more and more now about how important it is for maintaining a healthy microbiome. And the fact that the microbiome is doing more signaling and many more activities than we ever understood before. Most people don't get enough dietary fiber. We need both the soluble fiber, which helps protect against heart disease, and the insoluble fiber, which helps keep a healthy intestine and a healthy microbiome. When we look at the intake of dietary fiber, almost nobody meets what's recommended. It's just another major target to focus on. Moving into the B vitamins. Folate has been in the spotlight for the past few decades as a very important nutrient for cognitive function, DNA methylation, preventing high homocysteine. And it's kind of in a tricky spot right now because many older adults don't meet the recommendation for folate. But at the same time, others are exceeding the upper limit. It's got a narrow range. And so what you want is to maximize your folate intake from foods like beans and greens and nuts. But be careful not to get too much from folic acid, which is in breakfast cereals, and supplements. So if you have breakfast, and some older people eat a lot of breakfast cereal. So if you have 2 servings of breakfast cereal a day, like total, that has 400 micrograms of folic acid, and you take a supplement with 400, you're already exceeding the upper level. Why do we care about this? Well, first of all, it has been associated with accelerating, not only masking, but also accelerating vitamin B12 deficiencies, which often go unnoticed and can cause neurological deterioration. It's also been associated preliminarily with some risk of cancer, and ironically, having the right amount prevents cognitive decline, but there's some limited evidence that having too much in the folic acid form may actually accelerate it. So it's a tricky nutrient to watch. Here's the most recent 11 to 12 Haines data, and we do see that particularly elderly females or older women, 71 plus, do tend to not have enough folate in their diet. This is just from food, not counting supplements. So we want to push it more from food. But we're already seeing folic acid being above the upper level for 2 to 4% of the population. And as it's added to so many new foods and special formulations, this is likely to increase. So it's something to be careful of. Vitamin B12 is one of the vitamins that I'm most concerned about as I've been studying nutrition and aging. It's important for protecting nerves. Deficiency leads to peripheral neuropathy, balance problems, and disability. Inadequacy also leads to high homocysteine, and now that more people are receiving folic acid from the fortified food supply, B12 is emerging as one of the major considerations in high homocysteine. And it's often undiagnosed because people think they're getting enough from their food, but in older people with reductions in stomach acid, it's not able to be absorbed. It's not able to be broken from the protein in the food. So that what we see then is that, yes, part of B12 deficiency is inadequate intake. And we see in the Haines that 8 to 9%, particularly in women, have low B12 intake. But when we looked at it in the Framingham heart study, many more people have low status than have low intake. So that's unusual. We don't usually see that, but that's because of poor absorption. So one thing is that acid blockers are very, very common, and they block the acid so that they block the ability to absorb B12. So one thing I always tell everybody, if you're on an acid blocker, take a B12 supplement. The supplements are more easily absorbed than the B12 from food. Vitamin B6 is another really, really important nutrient for all of us. It's associated with all of the chronic diseases that we're seeing right now, diabetes, metabolic syndrome. It's involved in many metabolic reactions. It also is involved with homocysteine and with immune function. So we're looking at it right now in relation to depression. We see a very strong link with vitamin B6 deficiency and depression and cognitive decline. And this one is very commonly low. It's seen in all the populations I've looked at. It correlates very well to the blood levels, and it correlates very strongly to chronic disease. So it's something that's not on a lot of people's radar and needs a lot more attention. Here it is again in our study of Hispanic and non-Hispanic white elders in Massachusetts. This is the blood levels. So the blood levels were low in a very large percentage of both groups. And this again was individuals over 60. Here's what we were looking at in cognitive function, a figure copying score, which is a measure of executive function. And you can see in this slide that tertiles of vitamin B6 in the light blue in blood and in the dark blue in diet, both what you eat translates to what's in your blood, and it's very strongly associated with executive function. So very important nutrient that needs a lot more attention. And vitamin D, one of the hot nutrients over the past decade. There's a lot of people saying we need mega doses. It's still controversial. It's still being studied. But we are finding that it's not just about bone. There's a lot of vitamin D receptors throughout the body. It's been found to be associated with neurologic conditions, including multiple sclerosis and other autoimmune diseases, diabetes. And older adults are at particularly high risk of vitamin D deficiency. One, they have less exposure to sunlight. They don't get out as much. It's hard to get enough in the diet. It's in limited food sources like fortified milk and fatty fish. And as I said at the beginning, older people have less capacity to synthesize it in the skin from the sun and to convert it to the active form. So vitamin D supplements, especially if you live in the north, are usually a pretty good idea. You don't need to go overboard with them, but it doesn't seem to hurt to take it, particularly as we see now, almost everybody doesn't get enough from their diet. And it can be very protective of many things, although it's still being actively studied. Here it is with cognitive function again. And this is the NAME study, the same study I mentioned before, working with Irv Rosenberg. And what we see here is that there was significant differences in ability to answer this cognitive test depending on vitamin D status, with less than 10 nanograms per mil being particularly poor. Okay, moving right on. Vitamin E is important as an antioxidant and for immune function. It's another nutrient that is being hotly debated. The current RDA is based on alpha tocopherol, and there's some discussion about whether that should be changed and discussed more in the next iteration. But this is another nutrient that almost nobody gets enough of from foods. It comes from nuts and seeds and plant oils. And as you can see here, particularly the 71 plus group, and this is an error, I apologize. This should be 90, not 9%. Most people do not get enough vitamin E. This is Samin Meidani's work, where she shows the importance of vitamin E on immune function, giving a skin test and seeing the reactivity. So higher vitamin E doses protect against that. But we have to be careful with vitamin E. Working with the Jackson Heart Study, we looked at the blood of men. It seemed there were a lot of men in Jackson, Mississippi, taking vitamin E. And what we find is that when they take vitamin E as alpha tocopherol, we see lower, actually half the level of gamma tocopherol in their blood. And we don't fully understand the implications of that, but there are many researchers finding that gamma tocopherol also has important functions. So we need to be careful whenever we take a specific form of a nutrient that may affect other forms. I'm just going to flip through quickly the rest because I'm running out of time, but vitamin K is another one that's important for blood clotting and for bone health. It's in green leafy vegetables and plant oils. And it's another one that most people don't get enough of. So again, a lot of these things overlap in terms of just getting a good quality diet. Calcium, we know, not only for bone, but for blood pressure. Another one we don't get anywhere near enough of. Magnesium, very important for regulation of calcium and potassium, part of bone structure, also for blood pressure and for diabetes. Also, a big shortfall nutrient in the older population. Potassium, main intracellular cation, important for optimal functioning, neural transmission, related to hypertension, CVD, and osteoporosis. Almost nobody gets an adequate intake of potassium. Again, fruits and vegetables, good quality foods, unprocessed foods contain potassium. This is just an example of our study where we found that both magnesium and potassium are associated with bone mineral density and protecting against bone loss over 4 years. So overall, there's this whole wide spectrum of nutrients that older people are not getting enough of. They each have their own functions. Many of them protect against the chronic diseases we're worried about, heart disease, osteoporosis, diabetes, and it can make a huge difference, cognitive decline. So now we tend to look more at dietary scores and look at the total quality of the whole diet, dietary patterns. And this is just an example from our work showing that the Mediterranean diet score had a very strong linear relationship with mini mental state exam or cognitive function. And the Healthy Eating Index, which is the USDA dietary pattern recommendations, also had a strong relationship with cognitive function. So we need to think about the whole diet in order to incorporate all these nutrients in it. So what do we recommend for older adults? It's a tall order. It's a lot to focus on. We need to have more fruits and vegetables first and foremost. Fruits and vegetables, half the plate. And more nuts and legumes to get that protein, vegetable protein, vitamin B6, magnesium, and dietary fiber. More fish for the N3 fatty acids, and more low-fat dairy products, which will provide protein, magnesium, calcium, potassium, vitamin B12, and vitamin D. And more whole grains to reduce the glycemic index of the refined grains, but also to contribute vitamin B6, magnesium, dietary fiber. And in some cases, fortified breakfast cereals are a very good source of the vitamin B12 that is absorbable as well. And at the same time, of course, in balancing our energy and trying to pack all this in with less calories, we need to limit the refined foods and the foods that are high in sugar, solid fats, and sodium. So with that, I will conclude with the Tufts My Plate for older adults and introduce the next speaker. The next speaker I'm very pleased to introduce is Gordon Jensen from Penn State University. And Gordon is going to talk to you more about BMI and mortality outcomes, another controversial subject.